Hi, my name is Tara Warwick, and I've put together a series of 7 different short videos on tips on how to make your documentation, your clinical documentation, more effective. In today's session, we're going to look at wording. So wording is very important to your clinical documentation. So some tips I would say is to try to use buzzwords in your clinical documentation to show reviewers that you're keeping up to date with what's going on. So some good buzzwords right now for clinical documentation would be using the words collaborative, embedded, function, sustainable, community. Those are all really good buzzwords to include in your clinical documentation. Some red flag words to avoid would be things like continued, maintain, seen. All those words, when you use those in your clinical documentation, it doesn't show your active participation in the therapy session. The other thing is to avoid jargon. So, try not to talk your way through things or to explain too much of what you did in your therapy session. Simple is better. So say it just as it happened and try to avoid putting any opinions into your documentation. Just be very objective with how you're writing it. Last is really looking at the abbreviations that you're using in your documentation. We all get to use abbreviations because we get, have so much documentation to do and we try to get through it. But really think about the abbreviations that you're using and using the ones that are standard and that everybody knows what those abbreviations mean. A good website for that, I'm going to post it on here, but it's iuhealth.org/images/uploads CLA abbreviations.pdf. They have a list of abbreviations that are approved and that are not approved for your clinical documentation. So thanks for watching the first video of 7 videos in our series of 7 on how to have better, effective clinical documentation. Thanks and have a great day.